Okay, now we're going to show you a few things about new patients and working through the flow. Okay, so this is my patient I have. It's a new patient checkup. Um, so you can, if you have their paperwork before and you want to load it before you start your chart or your encounter, you can click here on the name and it shows you basically just a quick view of everything. Um, you can't really edit anything other than just the appointment information here. So you can do one of two things. You can click the little person and that will go to the record, or if you do more, go to record. So that's where you go. That's where you can edit all of their information. It is a lot to see, like most things in Azalea, but also if you minimize this, so you don't want to see this every time you log in this way, you can minimize it and it saves it. But this is where you could see like their insurance, quickly look at their history once they have it in there. Count summary, we don't really have to know that, so that's when I usually will minimize it. If I don't need to know it, then I'm going to minimize it because I don't want to see all that stuff. This is also where you will see chart notes. So what we call chart notes in Health Fusion are called comments in Azalea. So if I wanted to add a new comment that spoke with mom to bring shot record before the appointment, then I can put that in there and it saves it. It is time stamped and logged, so everyone knows exactly who did it. So those will all be there. Also, pop-ups are right here. Pop-ups are basically alerts, but they are exactly what they say. They pop up every time you open the chart. So if I wanted this one to say Spanish, then you can save that every time that it is opened in either the, and you can select who you want to see that. So if I only want, me and my medical assistants to see that, they can. Or you can select everyone, just the front office, anything like that. You can specify who sees that and in what area they see that. So that will be when it pops up. So if you go into create an appointment, it will pop up, this patient needs Spanish. Or if you go to look at the patient's chart, it will pop up, they need Spanish. So I'm going to minimize those because every time I log in, I don't want to see all of that busyness. This is also where if you wanted to do histories before they come in, you could do that. So you go to medical and their history. You can do it this way. I think I would prefer for everyone, at least for now, to do it through patient history and create new. The reason is because we have put our forms in here just like they are. So this is a 5-year-old, so we don't really have to do a birth history. So we do the medical history form. And this is, like I said, our medical history form. So I would click on the things that pertain to this patient. Headaches. Let's see. Circumcised. You can put the date in there. You can put where, if you know. And then you just go through there and fill this out exactly, how it is on the form. So that is on there. And if you save that, every time that you open a patient encounter or chart, as they're called in the system, that will be on there. You can also add allergies from this part. Clicking on allergies, you can click here, no new allergies. If you want to add allergies, then click on new allergies. Click new allergies. Depending on what you're adding, so if you're adding a drug allergy, you will go here and it will pull up Dr. First. And that's where you can click add new allergies. You can select common ones, so amoxicillin is here, other antibiotics. We'll click amoxicillin. Say they had abdominal pain and it was mild and it happened yesterday. You can save that and it is in there. If you added the wrong one, then you just delete it. If the provider talked to them and told them that abdominal pain is not an allergy, then that's when you click that little inactive button there. If you click it again, it marks it as active. So, and once you're finished with that, you can save and close. So now we have most of our history in there. We filled out the medical history form, the allergies. If you wanted to add any vitals, you can add them in here. I think we've all been practicing on that. So if I know that yesterday they went to another doctor and they were 40 pounds, oh, no, not 40 feet, they were 40 inches and 40 pounds. That will be there. And their BMI is calculated for us. You can also click on that and it gives you the percent and save that. It'll be in there. While we're on this page, I'm going to show you how to also print growth charts. So you click on this print vitals. That is that one where we just see the weights and heights and everything. And then growth charts is here. If you have multiple, it shows you the dots. Oh, can't see it on 24 though. It shows you the dots and the lines, and then you print it. It does print kind of small, so you can scale that, make it larger. I think it's 140, fit it to the page. Nope. Just play with it, and again, once you do that, it saves it, so you don't have to do it each time. They're supposed to be working on that. If there's any lab orders that need to be reviewed, this is how you do it. So all from the patient record.